I've just given sort of an overall subtext to this discussion, and we've been sharing communications on this ahead of the event. So I'm going to, if I may, jump into the questions. And I would invite, in order going along, that we could give some feedback on this in terms of what your own experience is, how you feel that things can be enhanced and improved, particularly with regards to health. In terms of building a robust health infrastructure that can fight and protect the world from the next health crisis, what are the areas that will require investment? And could you give us some potential 3 to 5 areas of investment opportunities in your opinion? So if I could pass over.
So seniority just for me. So thank you for giving me flow. We all know that alone we can do nothing, but together in partnership we can overcome the most challenging issue eventually. We individually and as the whole ASEAN should be hand in hand for building investment regime which can be sustainable and resilient to fight against similar shock. So let me get back to my points to my country, need for our country. So my key point is 2 things. So one is for hard infrastructure, and another one is for soft infrastructures. For first, I would like to point out for first infrastructure development. So our country situation is pretending to landscape for pharmaceutical aspiration. Only 2 state-owned pharmaceutical factories and 7 private-owned are currently operating in Myanmar. So the local capacity of medical production is rendered just 15% out of total medical and pharmaceutical demand, and it's remain 80%. They are sustainably import from abroad, especially Bangladesh, India, and China. And another one is, so the manufacturing of medical and pharmaceutical products need to be I would like to indicate we do not develop the serving degree to hard infrastructure for getting access for universal healthcare. In Myanmar, as a nationwide coverage, a total 5,124 general clinic, over 1,002 special clinic and 270 general hospitals are now operating. So as you mentioned that the Myanmar situations and Myanmar population is over 50 million, and our infrastructure is only the 5,000 and 6,000 like that. So our country is also urgency task for us. The next point is to promote HRD, the soft infrastructure. This sector, the WHO data say that there are only 6.1 doctors per 10,000 people in Myanmar. With the regional and international collaboration, we need the range for medical-related activities, like opening more medical training, school exchange program, and so on. My last point is digital transformation. It can supplement to all the healthcare activities, including telemedicine, be reached to the remote area, e-health record, and smooth e-licensing process as well. So these 4 points are our country need to promote that.